इस वैश्विक महामारी कोरोना से प्रभावी मुकाबले के लिए एकमात्र विकल्प है सोशल डिस्टेंसिंग।
The first case of Covid-19 in India was reported on 30th January 2020 among 3 Indian students who had come from Wuhan, the epicenter of the pandemic. The first case was reported in 3 towns of Kerala. Lockdowns were announced on 23rd March in Kerala and on 25th March in the rest of the country. Infection rates dropped in September. By the mid of the September, 90,000 cases were reported per day in India, which dropped to 15,000 cases by the end of January 2021. As the second wave began in March 2021, the second wave proved to be much more devastating than the first wave due to shortages of beds, oxygen cylinders, vaccines, and many more medical supplies in different parts of the country. Experts stated that the virus would reach its endemic stage in India rather than completely disappearing. By late August 2021, Soumya Swaminathan stated that the virus had reached its endemic stage in India, that is, the country will now learn to live with the virus. By December 23, 2021, the cases in India were 78,000, which further dropped to 21,000 by March 2022. India began its vaccination program on 16 January 2022 with Covishield and indigenously made Covaxin. Later, Sputnik V and Moderna vaccine were also approved for emergency use. On 30th January 2022, India announced that it had administered 1.7 billion doses and that more than 720 million people were fully vaccinated. They say we humans are evolving, growing stronger day by day. From the age of AI to the edge of the galaxy, we have seen it all. But a mere micron virus stopped the whole world. Good morning. Today we have Dr. Kaushik Chatterjee with us, who is a cardiologist and works at DSP Hospital. Today he has given us his valuable time to question him about the coronavirus outbreak. The first question: how did you manage your professional schedule to manage both profession and family simultaneously?
Whenever you enter into the medical profession, you have lots of responsibility on your shoulder and your mind is prepared in that way. In this regard, I would like to thank my family also, who always stood beside me and gave me encouragement, and my wife and my children also. They helped me a lot to cover my professional responsibilities, because they help me to do the things as I like. I can't give much time to my family because of my professional requirements. All the time I have to be busy in my hospital, especially during this COVID pandemic. We worked 16 to 18 hours per day.
What were the risks that a frontline worker had to take to serve the nation?
Yeah, this is a very vital question. The thing is that, the nation is responsible. The healthcare, in fact, the healthcare system is totally responsible for the nation's development, because if the healthcare system fails, then the nation will be in deep trouble. The thing is that not only doctors, healthcare workers include the nurses, the paramedical staffs, the biomedical technologies, and the pathologists, all those. The thing is that they all have to put on a brave face and give it their all out to go and serve the nation.
So your third question is, what were the scenes you saw from your own eyes during the first wave and second wave in the hospitals?
Yeah, as we were directly involved in this patient care treatment, so during the COVID time, we saw a very sudden rush of patients, and most of them were very much ill.
The first Covid-19 case in South America was recorded on 26 February 2020 in Sao Paulo, Brazil. It had spread to all other countries by 3rd April that year. South America as a whole was not ready for the pandemic. Some countries like Argentina and Ecuador managed to pull it off pretty efficiently. In Argentina, multiple lockdowns were imposed from 19 May 2020 and the government was praised for its actions. Over 9.5 million cases and 129,000 deaths were recorded till 16 July 2022.
Brazil became the third most affected country with over 2.62% mortality rate due to COVID-19 that year. With over 33 million cases and over 1 million deaths, it became an epicenter for the virus. The government was criticized for its bad implementation of the preventive measures. Peru was also shaken up by the virus. Over 1 million cases were found, and it was noticed that in the later period of time, children became the main carriers of the virus. Venezuela was already under a socio-economic crisis before the virus even began, and when the virus came, the situation became much worse. Massive food shortages and understaffed hospitals could not save the people from infection. Well, Chile had an interesting case. The government initially implemented no lockdowns or safety measures. However, as the cases shot up in May 2020, lockdowns were implemented and deaths were at an all-time high. Due to this, the people also did not protest, and Chile became one of the first countries to be fully vaccinated against the virus. As of July 16, 2021, whole of South America had 34 million cases and over 1 million deaths. A whole lot of people lost their jobs and died due to hunger. Small businesses shut down and people were desperate for the money. The monthly donation of $120 given by the Brazilian government helped the people quite a lot. Clusters of infections and deaths in nursing homes, prisons, etc. occurred in every part of the continent. COVID-19 exposed South America's fragility and how anything or sudden could destroy the continent from every side, from edge to edge.
COVID-19 pandemic has spread to all 55 countries in Africa. The prevalence is highly heterogeneous and the majority of the cases are asymptomatic. Several factors are thought to explain heterogeneity of COVID-19 in Africa, including the level of containment measures, demographic aspects, climate and environmental factors, host genetics and immune factors.
The first three cases were reported in France on 24th January and had onset of symptoms on 17th, 19th, and 23rd January respectively. The first death was reported on 15th February in France, as at 21st February, 9 countries had reported cases: Belgium, Finland, France, Germany, Italy, Russia, Spain, Sweden, and UK. On 27 January 2020, the European Centre for Disease and Prevention and Control and World Health Organization Regional Office for Europe asked countries to complete a WHO standard COVID-19 case report from all confirmed and probable cases according to WHO criteria. The overall aim of the surveillance at this time was to support the global strategy of containment of COVID-19 with the rapid identification and follow-up cases linked to the affected countries in order to minimize the onward transmission.
France is one of the European countries hardest hit by COVID-19 pandemic. The pandemic brought into light the structural weaknesses of the health system, including its governance and decision-making process, but also provoked changes that helped in improving its resilience. We could analyze the French experience of COVID-19 in 2020 by critically reviewing the major policies measures implemented during the first 2 waves of the pandemic. During the first wave, a full lockdown was implemented, which showed an emergency response that revealed the low level of preparedness for pandemics and overly hospital-centered province of healthcare in France.
By the end of April 2020, the COVID-19 pandemic in UK showed signs of suppression as daily reports of cases began to enter a slow decline. The UK government's delay in implementing physical distancing measures centered on how long the population would tolerate strict lockdown measures and on an ill-defined and dangerous notion of the creation of herd immunity by natural infection. This delay resulted in UK having one of the largest epidemics of any country at this stage of the pandemic when judged both by cases per head of population and mortality per case of infection.
First US coronavirus case was confirmed in Jan 21, and after 10 days, WHO declares the SARS-CoV-2 as global health emergency. And it was also proved, and many Chinese scientists confirms that COVID-19 is a human transmission disease and global travel was restricted. On March 6, a California cruise ship got its 21 passengers test COVID positive. After seeing the whole world suffering from such a devastating situation, WHO declared COVID-19 as a pandemic. And on March 13, COVID-19 was declared a national emergency and lockdown was declared on US. There was a ban on non-US citizens to travel to US. Though domestic flights were moving, but the passengers had to do their swab test and prove COVID negative before traveling. If someone was proved positive, they were sent to the hospitals immediately with proper care. On March 30, FDA authorities authorizes the use of hydroxychloroquine. After 15 to 20 days of lockdowns, 1st April, the American economy was hit too much bad.
At the end of the month of April, Innisfree showed a great positively and early promise towards remdesivir. Most of the hospitals of US and rest of the world started to apply this remdesivir, and suddenly there was a huge amount of shortage of remdesivir in US. India, being the largest producer of remdesivir, couldn't fulfill the needs of remdesivir towards the whole world. But India helped much the US government by sending the medics to the US land before fulfilling the needs of the Indian hospitals of the COVID patients. This shows the historical policy of India, Atithi Deva Bhava.
Coming back to the US, on May 28, COVID-19 cases of US crosses 1 million. Within 45 days, it crosses 3 million. And all this going on, US sets up a record of 75,000 in 24 hours. This was a huge number, but with the time, there were also going of many moments together. There was a great shortage of toilet paper, whereas US was the greatest producer and US user of toilet paper. Also, there was a great shortage of food supply chain on the outskirts of the cities as the workers couldn't work and the whole production process of the food supply was also locked down and food sector was also hit hard. On July, a study concerns that antibody cocktail may prevent the disease. So, the patients which were cured were called back to the hospitals to take their antibody sample and use them for rest of the patients. The Trump government signed with Moderna a deal of $1.5 million for 100 million doses of vaccine. On August 23, convalescent plasma is cleared by FDA for the patients as a therapy to fight COVID-19. Steroids was also used to reduce the mortality rate. Remdesivir use was also questioned with time by scientists and retired renowned doctors of US. How a hepatitis C medicine could be used to treat such a devastating and continuous mutating virus. On August 23, there was a first known patient who was reinfected from Nevada, but with time, the COVID reports decreased in US, and screening tests at airports were also stopped. At the last of September, global death surpasses 1 million. On starting of October, Trump and his lady both test positive, but he was discharged after 3 days and he was on home medication. After that, 34 more people of US Parliament were also test positive. But after the 4 months of trials and use of patients, Remdesivir becomes the first official drug of COVID-19. The second wave hit much hard through all over the world and equally in US. The starting economy again stopped down. In between, there was a shift of powers of US between Donald Trump and Joe Biden. But there was not much change in situation which was expected by the people of US.